It's us again, Dr. Rob Balko.
And Dr. Stephanie Lipnicki.
And we're here to talk about acupuncture, microneedle, and aesthetics. Before we do, I want to repeat our mission statement, which is our goal is to bring awareness about the many different ways to maintain health and heal your body, your mind, and your spirit, from acupuncture to Zen living and everything in between. So far, we've shared a little about who we are, how much education we need to do what we do, and in our second podcast, we talked about how to stay healthy in the fall. And today, we're going to talk about the ways that acupuncture and adjunct modalities can help improve appearance. Feel free to chime in with questions, and we may get to them as we go along, or we'll definitely answer them by the time we're done. Stephanie, how did you get into cosmetic acupuncture?
So before I went to acupuncture school, there's the chain of events of massage school, and then I finished at Rutgers, and people who I was massaging would tell me that I gave this great face massage and suggested going to school for aesthetics. And I think I had maybe looked at it quite some time before that, and you had to do the full cosmetology program. And around that time, which was roughly, I guess, 2001, they had separated it out and made a separate program. So I made the decision that I would, jump into it and go for it and go to school for aesthetics and add that to the repertoire.
That's great.
So then once I was in acupuncture school, naturally, of course, I was interested in, well, there has to be a way that acupuncture can add to that. And I started reading up on cosmetic acupuncture and how it could improve the appearance without using potentially harmful injections, things that didn't break down. You would see people injecting silicone in, and silicone doesn't break down. It just stays under the skin. And, some of the people in school would comment like, why do you want to do that? It's so vain. And I felt like if you look at the history through time, there's always been this move to try and, stay younger and find ways to stay youthful. So I feel like in the current culture, vanity is definitely at the forefront, and we're held to a high standard of appearance. When I was looking at statistics to share, in 2018, Americans spent more than $16.5 billion on cosmetic surgery. $16.5 billion. And in terms of wrinkle treatment injections, which is like your Botox, Dysport, Restylane, 7.4 million procedures were done. So It's definitely something that, people are interested in looking youthful, and it's not for everyone. There may be reasons that someone can't do that, or they don't want to inject harmful substances. So back, when I had skincare clients asking me about it before I even became an intern at PCOM, and I did my homework, and I think right before I started as an intern, I came across Dr. Martha Lucas's work. She does Maison cosmetic acupuncture, and she's based in Colorado, and she was teaching at the school up in Montclair. So I registered and took that class. It was a Maison cosmetic acupuncture for the face, neck, and abdomen. And I want to say that was around, 2007, because I think my daughter was around 2 at the time. And I completed the Maison course, and then I continued my training to become a preferred provider, and I eventually started teaching with Dr. Lucas, assisting her in various places that she would teach. First locally, like when she would come to the East Coast, and then I would travel with her to teach. And that was I fell in love with it then.
How does it work?
So it's obviously, I'm putting needles in the face. They're not the same as the body needles that we showed on the first visit. They're a smaller needle. I actually brought some of them here with me. So this is 10 needles that will go into the face. And they only go in about 0.5 millimeters into the, they're not going in very deep. So you're needling into the face, but you're also getting a body treatment every time. So it's not just about what's going on in the face. It's about making sure that the entire person themselves is feeling better. And, depending on what's going on, some people may need a few body treatments before they start. So somebody comes in and I do an initial evaluation, and maybe something throws up a red flag that I'm like, let's work on fixing this before we jump right into the face, and make sure that, let's say if their digestion is off or whatever else is going on. Let's say they have headaches. I don't want to start putting 100 needles in their face if there's someone who has headaches, and it causes that rising upward sort of sensation. So it's about also maintaining their health and wellness of the body as well, not just their face. So I assess them. We may do a series for their face and or their neck, and then maybe they need microneedling as well, and they might need a series of peels. It all just depends on when they come in and what they tell me that they're looking to achieve. Mayzen is generally done as a series of 10 treatments over 5 weeks for the face, and then 10 treatments over 5 weeks for the neck. Microneedling is a series of 4 treatments, like once a month. Glycolic peels, you can do one every 4 weeks, and then there are certain times of the year that I just don't recommend doing peels.
And are they getting a body treatment during those 10?
Every single treatment, they're getting a body treatment. So like the 10 treatments over 5 weeks, they're twice a week. Each of those includes a body treatment so that they're balanced and feeling good each and every single time.
And what are some examples of what the body treatment is doing for that person?
So let's say they're going through menopause and there's a lot more heat. So maybe the points that are in there are balancing that out to sort of quell some of the hot flashes and things like that. If they have trouble with their digestion, points might be put in to balance for that. If, let's say a particular area of their face is more of a concern, like they're a former smoker, they're going to tend to have small fine lines around the mouth. You might do points that open up the central line of the body so that the energy flows more to that area.
So you don't do the face and the neck at the same time?
No, I do them separately. But each time the patient is coming in and getting the treatment, they're getting an assessment. I'm taking their pulse. I'm seeing if anything else has changed or come up. I prep their face. I put the body needles in. And then once I know that they're balanced, I put those face needles in. And then same just like a regular acupuncture treatment, they are laying there relaxing for part of the time. So that's kind of, they get that same acupuncture nap that they get with a regular treatment. So it's not just that, although microneedling, I'm in the room the whole time. With the cosmetic, the Mayzen, I leave the room after the needles are put in. And then I come in and I pull them, and then I do, I tone the face. I do a little bit of face massage, and just kind of, it just feels nice after you've put all those needles in.
Sure. Are there cases where they need more than 10 treatments? Yes.
So let's say someone comes to see me and their age is a component of it. I usually like to say that the ideal age to start is in your 30s, because then you're doing this more preventatively. You haven't, had the same exposure to the sun. And so if someone is a little older, they may need the initial 10 treatments, and then they may need another 10 or they may need another 5. We reassess at the end of the 10 to see what their results are. And I'm taking pictures so they can see before and after, because sometimes practitioners will say that they've had someone say, well, I don't see any difference. Well, if you're doing a series of photos before they start, and then you show them to them at the halfway point, and then at the end you can say, like, look and see how this is different, look and see how that's different. If someone was a smoker, they're more like, and not just like, oh, I smoked for a little while when I was 17, 18. Somebody who's like, yeah, I smoked a pack of cigarettes a day for 20 years. They're definitely going to need more work. They're going to have all those small lines around. And if they're still smoking, I don't even want to take them on, because I feel like you're undoing everything that I've done. You're going to come in here and spend the money to do this thing that's supposed to help make you feel better, and then you're inhaling toxins. So the first thing I want to work on for them is get them to quit smoking. And if they don't quit smoking, I don't want to take it on, because they're just not going to get the same results as somebody who's not a smoker or somebody who quit smoking. If somebody was a sun worshiper. Like, I grew up here in New Jersey. We used to go to the beach and put baby oil on our skin and then, get like a crispy critter. And I'm sure I've done so much damage to my skin from that. If someone has never taken care of their skin and they tell me that they've been using bar soap and this is the first time they've ever done anything, I want to get them on a skincare routine. And they could have not been taking care of their skin and it could be okay, but I still need to assess and see what's going on. So like they may say something on the phone, but I want to see. Genetics play a part in it. Some people just handle stress better than other people. Some people age more gracefully than other people. That's beyond my control. I'm not the one doling those things out. If they have a history of acne and they have acne scarring, that might take a little more treatment to resolve some of that. But you do see it different with the acne scarring. It does kind of reduce the appearance of the scarring.
Right. So can we talk about the microneedling and the peels and the facials? Like what do they do and how are they different from each other?
Okay, so the cosmetic acupuncture is going to tighten and firm the skin. It will soften fine lines and wrinkles. Some people need the extra step of the microneedling, which will soften them even more because it's going in, below the epidermis into the dermis. So it's you're getting hit like rapidly with tiny little needles, and it allows serums to go deeper into the skin after the treatment. Glycolic peels are really just taking care of the surface part of things. So let's say somebody has never exfoliated their skin. I'll do a glycolic peel and it will peel and look like spider webs and their skin coming off. And it will make the skin look softer and it'll appear more dewy. When they do that, their moisturizer penetrates deeper. They're not just moisturizing like dry, dead skin. It hydrates the skin more. The edges of wrinkles tend to be a little bit sharp looking. So when you're doing cosmetic acupuncture or microneedling, it's going to give that edge a less sharp look. So the skin will look softer. So you still look like you, just a more youthful version of you.
Mm-hmm. Yeah, I remember some patients of mine were talking about facial acupuncture. It didn't sound like they were getting the kind of treatment you were doing.
Okay.
But the response they were getting from their friends were that you look like you were on a 2-week vacation in Tahiti.
Yeah.
You came back all blissed out and relaxed and happy.
Yes. I had a patient who did it before one of her high school reunions. And they were like, oh my gosh, what are you doing? You look amazing. And, she's telling me this afterwards. And she said, well, I wasn't going to tell him. And I'm like, are you kidding? You weren't going to tell him? I'm like, you couldn't give me any credit so that I could. Yeah, I'm like, you should have been doling out my card and been like, here, you have to go see Stephanie. You have to go see her.
That's
but
right.
no, but she did say that. So some of the things that people will say when people are going through it, like people will go, well, I'm not noticing a difference. But people around them will say, like, did you change your hair? Something looks different.
Right, something.
Yeah, there's a little something that looks different, but they can't quite put their finger on it because who's going to think that you're doing cosmetic acupuncture or microneedling?
Right. So what are some of the things that the processes you do not do for the skin?
So it's not going to give you a facelift. You are not going to reshape your face in any way. Like if someone comes in and says, I don't like the contour of my nose, I don't like the shape of my nose, I can't fix that with needles. You're talking about surgical procedures for that. Where Botox paralyzes the muscles, it's not going to paralyze your face. And some of the studies are showing that the long-term effect of repeatedly paralyzing the muscle, like when you think of how do you build muscle by exercising a muscle. So if it's paralyzed for a period of time, you're not strengthening that muscle. Right. So it leads to that dependence on it. And then, it could, in the long term, you're losing more of the strength and integrity of the skin, whereas the cosmetic acupuncture, because it's bringing energy and blood to the face, you're strengthening the integrity of the skin.
Great.
So yeah, I mean, you're not going to look like your favorite movie star when you're done. Like, believe me, I would love to look like Salma Hayek, but clearly I've done cosmetic acupuncture on myself a lot of times. I still don't look like her. And it's, when I think of when I was a kid, one of my favorite movies was, I think it was The Muppets Take Manhattan. And Joan Rivers was in it. There's a scene where Joan Rivers is in it with Miss Piggy. And I feel like the Joan Rivers right before she died, she didn't even look like the Joan Rivers of like the 80s. And I think I can remember my mentor saying that she used to talk about, just put a screw in the top of my head so that I could tighten it. And I do feel like her skin just kept looking like it was going further and further back. So cosmetic acupuncture is not going to do that.
I have a joke for that, but we'll do that off the air.
Oh, no. Is it that bad?
It's that bad.
Oh, no.
I'm going to spring something on you and ask you, tell us about the side effects of the procedures that you're doing.
So
which I'm sure you explain to your patients.
I do.
That there are possibly
there are
some downsides.
So one of the things that I always explain to people is that so no one's face is symmetrical. So you're still not going to look like things are symmetrical. So one side might have a better response than the other side of the face. The only real bad side effect, and I don't even want to say bad, is that you tend to have bruising. And and the bruising doesn't actually happen at the beginning. It seems to happen towards the end, towards like treatments 5 to 10 or 6 to 10. As you're bringing more blood and chi to the face. Right. So like, let's say I have someone who comes in and they're the mother of a bride and they're doing this before the wedding. Right. I'm not finishing like the week of the wedding. They're done like 2 to 3 weeks before the wedding, because if there is any bruising, I want to make sure that minimizes. And someone like I'm on a lot of herbs for other things going on in my life that tend to thin blood. So I just did my neck, and when I tell you it looked like I got mugged, my whole neck was black and blue. So that can happen. But I feel like the side effects are more positive. There are things like your digestion improves. People might not, they come in and they say their face is the chief concern. And they'll say something like, I noticed I sleep better now since I started doing this. Because I am balancing the body at every single treatment. Or they'll say, my cycles were irregular and they didn't tell me that when we started. And I've noticed that, my menstrual cycle is a little bit better. So things like that. And like I said, some people tend to have headaches occasionally. They might not bring that up on the first visit, although I usually try and question them thoroughly enough that I know that headaches are an issue. So those sorts of things resolve. Botox, compared to Botox, you're not going to, the needles are going in very shallow. I have heard stories of people doing Botox and the way that it migrates, maybe their eye doesn't blink for 6 months. Right. Well, if your eye isn't blinking, your eyeball is drying. So like at night you have to tape your eye shut, and there's nothing you can do about it for 6 months because the Botox has to wear out. There's no...
You don't do Botox though.
I don't. Not for myself.
I just want to make it clear.
No, this is all my own skin. And that was why I joked when I was promoting tonight and talked about the fact that the joke in my house is that I steal babies' butts and I put them on my face, and that's why my face is so soft. It's the baby butt face. So I sport the baby butt face.
Okay.
Moving
on. How long do the results last?
So if you start taking care of your skin, like I said, in your 30s, and I like for people in their 20s to be getting facials regularly. It's a self-care thing. It's preventative. It feels good. But if you start doing cosmetic acupuncture, microneedling, it can last 2 to 3 years. So like my own face, I usually do the face every 2 to 3 years. Well, I'm still on like every 3 years, and the neck every 3 years. Someone in their 50s, I'm going to say every 1 to 2 years, I want them to complete the whole protocol, like all 10 treatments, and then in 2 years, all 10 treatments. And then someone in their 60s, I'm going to suggest that they complete the protocol every year with the possibility of adding monthly maintenance. And I do have some people who prefer that they continue it. They just like the way it feels. Or every like 3 months they'll come in and they'll do one on the face, one on the neck. Glycolic peels, like I said, I don't do those in the summer, and that's because of the hyperpigmentation and freckling. I don't want that to increase. So usually like I'll do those from, let's say, Labor Day through Memorial Day. Every 4 weeks you can do that. And the microneedling, I would say you do the series of 4 every year, or if you are very concerned, you could continue to do it once a month. And again, you know, you can do it in the summer. I just tell people, you know, stay out of the sun for a period of time afterwards. If for some reason I get the vibe that they're not going to listen to me, I just won't schedule them. Which is, you know, you want people to listen to you, but people are going to blow sunshine up your, you know,
Right.
and maybe not listen.
Yeah, that was a question I had, is what exactly do people have to do at home really to get the best out of the treatment? Because it's not just what you're doing.
Right.
Obviously, it's making a big difference. I mean, they're feeling better internally, right? On so many levels. But then you're showing them photographed results.
Right.
But what do they have to do to really make it the optimal experience for them?
So minimally, I want someone to at least cleanse, tone, and moisturize their skin. And by cleanse, I don't mean using bar soap in the shower. A cleanser that's designed to be used on the face, at least in the morning and at night, toning the skin to rebalance the pH, and a moisturizer with an SPF. I'd like for them to use a different moisturizer at night, something that's a little bit more hydrating and restorative, but if they're not, they can still use the one with the SPF. And the reason I say SPF, even in the winter, I feel like everyone should have an SPF on all year long.
All year long.
All year long. Because you're still getting, you could be in the car for 15 minutes and you're still getting the rays from the sun in your car driving back and forth to work. We had this conversation in my house probably like a few weeks ago. And I was trying to explain that you need to have a moisturizer with SPF, not using a body moisturizer on your face because they tend to have a different consistency and maybe be a little bit more greasy. And so we have this joke, we talk about asking the Google. And I was like, you go ahead and ask the Google about what truck drivers look like people who are driving big rigs across the country on the left side of their face. And when you Google those pictures, there's a loss of elasticity, there's tons of hyperpigmentation. It's like looking at 2 different people because there's so much going on. If they're getting that routine down pat, I might ask them to add in an exfoliant. I don't exfoliate every day because I feel like it's abrasive. I do want to take some of that extra dead layer away so that I am getting the moisturizer deeper in the skin. But I don't want them exfoliating every single day. And when they pick an exfoliant, I don't want it to have like shells in it. Like there's body scrubs that have like walnut shells and stuff. You're scratching, that's fine on your legs, but your face is exposed more. Like I have socks on already. It's that time of year. You're not seeing my legs. So if I'm using a salt scrub on my legs, it's not so bad. I wouldn't necessarily do that to the face. You want an exfoliant that's a little bit more gentle.
Do you have them change the products through the seasons based on light or being outside or inside?
Well, if somebody tells me that they're into more sports, I might have them do an SPF that's a little higher than 25. If they're someone who tends to have skin that's a little bit more dry in the winter, I'll ask them to use like a creamy cleanser versus like a gel cleanser that's going to foam a little bit more and be a little bit more drying. I use a creamy cleanser all year long because I tend to be more dry. My skin is dry overall. So I almost never, I think the only time I use the one that's a little more gel-like is after I've done a peel, because that's the one that comes in a post-peel kit. There's a kit that they give you to give to people when they come in for a peel. So when they do that, I'll use that. And like I said, I use the Physicians Care Alliance PCA skincare, and they have extensive serums. So let's say somebody's like, I'm concerned about lines and wrinkles. There's a product that is made for lines and wrinkles that I'll have them add in, and they can put that on under their moisturizer right before they put their moisturizer on and after they tone their skin. So because I always want to make sure that they're doing these things, like they can come in and I can say, okay, this is what I want you to do. And if they leave, so I when they're doing a protocol, I just give them the products that I want them to use in the weeks afterwards, because then that gets them on that routine, and then they'll carry it over after that.
Are these some of the products?
Right. So like this is actually the more foaming facial wash. This is the nutrient toner. So this is what you put on afterwards. And then I have the SPF 25. This is the Myzen Skin Balancing Serum. So after I pull the needles out when I'm doing the skincare stuff, I then massage that into the skin. So I probably only massage for like 5 minutes, but a 5-minute massage is, people love it.
Yeah.
They're like, they think it's so wonderful. And then this is the daily exfoliant that they say daily, but I always tell my patients not to do it daily. I'm like, just,
That's a lot.
3 or 4 times a week, every other day, but just not every day for that. And then sometimes I use this as a jade roller. And sometimes when I, at the end, I'll massage after I pull the needles. And then when they've completed all 10 treatments, I just give it to them to take, because I don't want to reuse this on somebody else's skin. So each, they get this at the end. So they're going home with all those things. And then, like I said, I add some serums in. I also like for them to do massage on themselves. So like I'll just show them some gentle massage techniques that they can do. And I'm like, if you can at least do it a couple of times a week, like obviously, ideally you would do it every day. Sometimes I do those motions, the massage motions, just when I'm using the cleanser in the shower. Just because I feel like, okay, let me massage my forehead a little bit and do some circles, and it relieves some of the tension. So I'll teach them some massage techniques. That increases the circulation to their face, and it only enhances the results.
Sure.
Some people, and I'm not one of them, some people use cupping sets when they do cosmetic acupuncture treatments. I don't do cupping on the face just because I started out as an esthetician, and most people love that massage that I do. And there's only so much time after you pull needles that you can devote.
Yeah.
I'm not doing a whole facial on them. I do sometimes do facial gua sha. So we talked about the gua sha that we do on the body, which is the scraping. So on the face, it's not that same kind of scraping that, like, if you were to use the Google again and Google gua sha, you would see very red images. That's not what you want in the face, because who wants to walk around with that image? But like having them gently, anything that I can get them to do some sort of, stimulation to their face so that they're getting more. So just things like that.
Okay. And diet type stuff? Or?
Okay, so there are definitely things that I ask them to do diet-wise. If somebody comes in and their skin is dehydrated and more crepey, I want to look at things like, are you drinking a lot of coffee? Now, I drink coffee every day. I don't drink a pot of coffee every day. Someone comes in and tells me they're drinking a pot of coffee every day. I'm like, well, that's contributing to how dry your skin looks. It's a diuretic. So, I don't expect anyone to get off of a coffee addiction overnight. I don't put those expectations on people because they're unrealistic. But like, okay, instead of having an entire pot of coffee today, how about we do 10 cups instead of 12 cups and slowly back off of that? Or if they're drinking a lot of soda, sugar sags. Sugar is, we talk about this on, in the other podcasts.
Yeah.
I mean, I'm a sugar addict, but sugar is the root of a lot of evil. It's not good. It doesn't, yes, a tiny little bit to sweeten something. I don't tend to drink a lot of soda. So if somebody tells me that they're drinking a lot of soda, I try and get them off of that.
Sure.
And then there might be other dietary changes that I add in if it's somebody who's going through menopause, maybe some foods that are a little more cooling, just to take care of other things that are going on in their lives. And just making sure that, sometimes I give them herbs depending on what their pattern is. So that's more individualized. It's I see you're in front of me and these are the herbs that I want you on because of other things that are going on, not necessarily because they're getting treated for their face.
Okay. So I wanted to go back to the other procedures that you don't do, the facelift, Botox, plastic surgery. Can cosmetic acupuncture help when that goes wrong?
depends on what goes wrong. So like when I said before about let's say you have Botox and it causes the droopy eyelid. I mean, you could try and needle that, but it could make it worse. It could make it migrate more. So I tend to try and wait until after that 6 months is up. And then if there's still some loss of like the eye blinking, I try and fix it then. If somebody has had plastic surgery and they don't like how it comes out, again, I can't reshape their face. I mean, maybe I could treat them for the emotional aspect of the trauma of it not turning out the way that they wanted it to. But it's not going to get the results that they were looking for. It can help with some of the bruising, things like that. If there's nerve damage, then yeah, I think that it can help with some of the pain from the nerve damage and try and heal that quicker. Sometimes there's loss of sensitivity to the face after someone has had a facelift or plastic surgery. So some of that can heal a lot quicker because nobody wants the loss of sensation afterwards. Sure. And when it's interesting that, one of when we were talking about side effects before, my mentor always tells the story of, how she was able to get a patient that had gone to have plastic surgery. And when the doctor said, "Do you have all of your affairs in order?" They were like, "What do you mean?" So I don't know if people realize, like, you're undergoing anesthesia. I mean, that's how Joan Rivers, that was a cosmetic procedure that she didn't make it out of. So that's one of the things that you have to consider, like, what lengths are you willing to go to? And what do you have to do to get the results that you want? So yeah, it just depends. Like I said, it's not going to change the way that you look if it doesn't come out how you want it to look.
So you're not putting anybody under?
No anesthesia, no. When I do the microneedling, I do put a numbing cream on beforehand. And then they lay with the Saluma over while it's taking effect. But I mean, they may get in the zone of like meditating for that 30 minutes while the Saluma is on. Right. So they may be putting themselves under into a meditative state, but it's not an anesthesia state.
Right. And the Saluma is a light therapy that uses red, blue light, infrared light to stimulate through the
skin. Right. So it has the pain setting. I think we talked about that. We both use it for pain, but it also has a setting for fine lines and wrinkles and acne. So I'll put that on, and some people do it also after the cosmetic acupuncture. Just again, it depends on how much time they have and what we talk about in terms of their treatment plan to get them to where they want. And that's one of the things too, like when someone comes in, I have to see, like, they may come in and I might be like, oh, well, their neck needs, that might not be what their chief concern is. Right. They may be like, well, I don't like XYZ. So I always want to know what their expectations are. And what do you love about your skin? Because if they're like, there's nothing I love, I'm going to second guess, like, if you don't love anything about how you look right now, I'm probably not going to make you love how you look in 10 weeks. Right. Like that's, so I don't want to take someone on who I don't think I can make them love themselves even more at the end of it. Yeah. So
this, with all this working so close to the face, how are you working with COVID situation?
So I have amazing vision. So I can actually needle from like the distance of like the table and stand up. I'm not leaning over into someone. So I'm keeping my mask on. I have my face shield on, and then I keep their mouth covered, but I unhook the ears ahead of time. So their mouth is covered, and then I uncover it right when I get to the part where I'm putting the needles in their mouth. Not in their mouth, sorry, around their mouth. They're eating the needles for lunch. I put them around their mouth, and then same thing, I come back in with, I have the face shield on. And that's as per like the New Jersey esthetician code, you are allowed to remove from the face, because some people are getting waxing and those kind of things done. So just making sure that my face is covered, and that most of the people who I've always worked on have always been honest with me. Like I tell them up front, if you have a cold while we're going through this, I'm not treating you for the face then. I'm treating you for the cold, or I'm treating you for the other thing that comes up. If something else comes up, I want the energy to fight the infection, not
Right.
we're not focusing on your face in that treatment. And my patients are good about making sure that they tell me that those things are going on ahead of time.
Are there any side effects that we didn't discuss for the
So,
Botox fillers? I kind of jumped ahead with that.
no, that's okay. So surgical procedures, any kind of surgery, you could keloid. So keloids are those scars where, like, okay, they make a tiny incision and now it's 4 inch, not 4, it doesn't have to be 4 inches wide, but it's like an inch wide, and it's a lot wider than the initial incision.
Yeah.
So let's say you have cosmetic surgery and you don't know that you're someone who has skin that keloids. That could happen around the incisions that they're making in the hairline, around the face. I've had patients have scarring from breast augmentation where they keloid, and I've actually done the cosmetic technique to try and break up some of that keloiding scar. If you have surgery and there are internal sutures, those sutures can move. So let's say that happens on you, you have some kind of surgery on your arm. I don't care if something moves from my elbow down to the middle of my arm, but I'm going to care if it moves from my forehead, or from my hairline into my forehead, and it's popping out of my forehead, and there's nothing they can do. Both have possible bruising. The only downtime when I do cosmetic acupuncture is that I maybe tell somebody don't go and exercise. Definitely for the first 24 hours after a glycolic peel, you don't go and exercise because you don't want to increase in sweat and do those kind of things. If you're having surgery, you could have weeks of downtime afterwards. Botox, I don't think, has downtime, but again, if it migrates somewhere and you're like I said, the eye example, and your eye doesn't blink anymore, or your mouth doesn't close the right way because you did these lines and now your mouth isn't functioning the right way. In terms of cosmetic surgery, where the younger you start having surgery, the more and more you have to get. And again, it goes to the example of, I love Joan Rivers, but she kept having to go for all these surgeries. When you start younger with cosmetic surgery, it's more preventative. Yes, you do have to get it done more frequently, but you're not going to not look like you at the end of, every 3 years going and getting treatments. You're going to look like you, but a healthier, more youthful version of you with, baby butt soft skin. Okay, I can't promise the baby butt soft skin because that might just be my skin. And again, cosmetic acupuncture isn't paralyzing your face. One of the things that I'm seeing studies with Botox now is that they're noticing that there's a rewiring of the brain. So let's say your hand does a movement and there's some connection with the facial muscles being paralyzed, that the messages are not being sent and received the right way. So that is not a side effect of cosmetic acupuncture. And when I was doing research, because I even with things that I already know, I try and do research on the current things that are happening. Psychology Today said that Botox injections in the forehead and face rearrange the brain's sensory map of the hands. What's concerning is that clients typically come back for regular injections because the limited paralysis the toxin induces lasts only 2 to 3 months. The ongoing question is whether repeated treatments over a period of years result in permanent changes to one's brain. That was from Dr. Richard Seidowik. So, I don't want to rewire my brain. I don't know who wants to have their brain rewired. I want it,
Not in that way.
No. You can still make facial expressions with cosmetic acupuncture. I remember when I first learned it, my mentor saying that there were some soap opera stars that it was in their contract that they couldn't do Botox because they wouldn't be able to, soap opera stars are like over the top. So they wouldn't be able to make facial expressions. So that was actually in their contract that they couldn't do that. So, and like I said earlier about the loss of muscle tone, are you going to lose muscle tone from repeatedly injecting it and the muscle's not moving? Now, maybe that's what someone wants, but I feel like eventually, so that's dealing with the lines and wrinkles. It's not firming the face. is it going to cause the face to lose more elasticity and then droop more
Right.
in 5 to 10 years? Where the Botox isn't going to take care of it losing elasticity. It's taking care of the lines and wrinkles.
Right. And we're really stimulating the tissue to
Right.
function at its level
Right.
when you were younger.
Yes.
Right.
So it's producing more collagen and elastin, and then the skin is more firm and more toned.
Right. Are there any new techniques coming along that you're looking into adding to your repertoire?
So in addition to having just recently added the microneedling, I'm looking at a technique called fibroblast skin tightening. So it, again, is another technique that works to tone and tighten sagging skin. And it's done in sections. Like you would pick, like, okay, I want my neck done, or I want the area around my eyes. It's more targeted, where when I do the Mazen, I'm doing the whole face. When I do microneedling, I'm doing the whole face. This is targeted areas that might be a chief concern of someone. So I just started doing the research on this to see whether this is something that I might add in that might be another way that I can help people feel and look, the best that they can. And, for me, I just, not even just with cosmetic acupuncture, I just always want to know as much as I can. So I'm sure that even beyond that, if I do the fibroblast skin tightening, there will probably be something else a couple years from now that I'll want to learn. And techniques change, new things develop. There's new lasers, there's new, all that stuff. So yeah. I feel like you constantly have to be reading and staying on top of what the best ways you can, best modalities you can incorporate to make your patients feel good.
That's great. Shall we go to the questions?
Yeah.
So Daryl is asking about back to bruising.
Okay.
Can you take arnica internally or rub it on the bruises?
So I put arnica on the face before I put the needles in. And if patients are sensitive, and I mean once every, like maybe 1 in every 20 patients will be more sensitive than someone else, I will give them arnica to take internally. And then they just take it like right before they arrive. If they have a tendency to bruise, if they're on blood thinners, I'm not going to tell them not to take a blood thinner, but I'm going to warn them, because like me, I'm on fish oil, I'm on turmeric. That's why I bruise when I do it to myself. I may tell them back off that a little bit. Let's see if we can, or just so that they're aware they may bruise a little bit more. Like, again, don't plan on going to some big event. It's the same thing right. When I cup someone on the back. Sure. I always ask them, like, listen, are you going to the beach? Are you going to an event where you have a low back dress? Yep. So absolutely, I put arnica on. And if I see a bruise pop up when I'm doing it, I will then rub a little bit of arnica on it. And if there's someone who I suspect that they might bruise a little bit more, I may send them home with the arnica gel as well. So topically and internally. Yeah, I do both.
Gotcha. Okay. So Hillary is asking, once a client's program is finished, what type of maintenance or product do you recommend after or in between the next time they complete the protocol again?
So I want them to keep cleansing, toning, and moisturizing. That's like the minimum that I want them to do all the time. If they do let's say they started the protocol in January, sometime in July, I want them to do 2 treatments in 1 week. And then in another 6 months, do 2 treatments in 1 week. So kind of every 6 months. But some people like the way it feels that they'll do once a month. And like I said, they can continue doing peels in between. We determine that at the time. Not everybody I love peels because I feel like my skin is so soft afterwards and it's glowy, and not everybody likes them. Nice. So some people don't do them at all. I usually start the protocol with a peel. So I'll do the peel, they'll wait a week, and then I'll do the 10 treatments, and then I'll do another peel at the end. But they don't have to do that. That's something that, because I have my skincare license, I added on and made it part of everything. There are plenty of people doing cosmetic acupuncture who don't do peels. Or you can go to your esthetician. Like if your cosmetic acupuncturist doesn't do peels, they're not an esthetician also, you can see your own esthetician ahead of time and make sure that you're doing those things maintenance-wise. And I feel like every 4 to 6 weeks is good to just get a facial. Just because it's somebody else making sure that they're exfoliating and they do steam. Facials are they feel wonderful. and your skin feels so nice and it's so glowy afterwards. And so, yeah, every 4 to 6 weeks, if they can. I don't do, I mean, I still maintain my esthetician's license. I don't do, like, you have to be really, really special to get a facial from me. Mostly I just do the peels. So yeah, doing the cleansing, toning, and moisturizing morning and evening. I want them to do to take that away from what we've done and keep that. And even if you're not someone considering cosmetic acupuncture, I think you should still cleanse, tone, and moisturize your skin every day.
Right. Okay. So Daryl is asking, what are your thoughts on SPF and chemical components that may be harmful with regular use? Are there ingredients that you tell people to steer clear of if they aren't purchasing Mazen products specifically?
I mean, I don't get into too much of that. Like, the PCA one is recommended by the Skincare Society, and I think that was the big for me that I look to see if it's recommended by the Skincare Society, because I feel like they're looking out for making sure that it doesn't cause problems. I will say if somebody has fertility issues, I might tell them, just not to use the SPF if they're concerned about what would be in it. But yeah, I look to the SPF being, something that the Skincare Society recommends.
Okay. And Hillary is saying a dermatologist once said that the best skincare was SPF and drink lots of water.
Yes.
Would you add anything to that?
Definitely the water. Yeah, I feel like every dermatologist is going to tell you to wear a hat. Like if you're like I go out in the garden, wear a hat so that your face is covered. I don't want people to be afraid to be in the sun at all, because I do think you need the sun for vitamin D. But you don't need to get it from your face. Right. Your arms can be exposed and get the vitamin D that way and have your face be covered.
Okay. So there's some comments I don't think I can see. Is anybody else? Maybe they're Ming's comments. Ming is our producer here. So yeah, I think that's it, unless there are more questions that anybody has, unless I missed something. Hillary asked about the seasons, and you answered that.
Yeah, I think that's it.
Okay. So we'll make a quick note that 2 weeks from now we'll be chatting about stroke and traumatic brain injury. So make sure you submit any questions you want answered during the recording, and we'll get to that. It's a really big topic and sadly growing. The numbers that I had in 2018 are now out of date.
Okay.
Stroke was the number 3 killer in the United States. Now it's number 2, closing in on number 1, like within a couple years. By 2025, it'll be the number 1 killer. And people are getting strokes younger and younger, into their 40s and 30s even. And then there's the traumatic brain injury part, which is sports injuries, all sorts of head injuries that we've had. I had a patient once, she was on the school bus, and they were horsing around, and some guy shoved her, and she whacked her head. Hasn't been the same since.
Wow.
Yeah. Really
I'm looking forward to it.
Really unfortunate.
Yeah.
But there's lots of great stuff that we're doing. What I do is comes out of China, but it's different from the stuff that most of us were taught, which is, you do the scalp points, you do the scalp points.
Right.
And it's a whole body treatment. It's a much more comprehensive treatment.
Right.
For the whole body.
Cool.
Yeah, good stuff.
So don't forget to like us on Facebook, follow us on Instagram, subscribe to the YouTube channel, stay healthy. Thank everybody for listening, and we'll see everyone in 2 weeks.
And take care of your skin.
Yeah, take care of your skin. And if you have other questions, you can always email us.
Awesome. That was great.